This past year has also put a major emphasis on the importance of mental health. We've all been living through very unorthodox and trying times, and it hasn't always been easy. For more, I want to bring in Dr. Laura Murray. She is a senior scientist and clinical psychologist at Johns Hopkins School of Public Health. Dr. Murray, welcome. Great to have you with us. You know, it has been exactly 1 year now since this pandemic has been a part of our lives, and so many of our lives have been upended. I think the best way to describe it is our world has been fundamentally turned upside down. What have you seen in your practice among your patients? What has been the range of the way people have been dealing with this?
Thanks for having me. Such an important topic. We have seen such an increase in anxiety and worry and uncertainty and restlessness, irritability, sadness, fatigue. We have also seen an increase in relationship problems and violence at home, as we know that a lot of people have been spending lots of time in their houses. We've also seen a big increase in substance use and suicidal thoughts. We know that over half of us are dealing with some pretty significant problems given the pandemic over the past year.
Former First Lady Michelle Obama recently spoke with People magazine about her battle with low-grade depression during the pandemic, and she said in part, to think that somehow we can just continue to rise above all the shock and the trauma and the upheaval we've been experiencing without feeling it in that way is just unrealistic. What is your reaction to Michelle Obama's words there?
Yeah, Tanya, I think what Michelle Obama did here that was so fantastic is she raised the issue. And anytime we see folks doing that, it helps to reduce that stigma and let us know that it's okay to reach out for help and that most of us are going to have these types of mental health problems throughout our life. And so I really appreciate that she came forward, and we've seen a lot more of that this year, and I hope we see even more of it.
And I'm sure as part of your work and research at Johns Hopkins, you speak with many different people from all walks of life. What would you say has been the biggest one thing you've observed about people's mental health during the last year? Is there anything new that you've learned?
Well, on the positive side, I think we've learned that people are amazingly resilient. I think that we've also seen a lot of people come together, a lot more people reaching out to others. So I think we've seen a lot of positive. We've certainly seen the pain and the suffering from all sides. I do think that our mental health system needs work. And so hopefully this will be an eye-opener and a stimulus for change. We've seen a lot of growth in the digital mental health, trying to create more access, easier access, and better access. And I hope that continues.
So let's talk a little bit about the return to normalcy. Inevitably, it will happen. It looks like we're inching closer to it, but we just don't know exactly when. Is it safe to say that some people are going to have a tough time transitioning? And if so, how should they cope with that?
Fantastic question. Wow. Life after the pandemic, a very common question. This is where skills like growth mindset and neuroplasticity come into play. So for example, instead of sort of the idea of getting back to normal or when will it end, really trying to work on our framework of what's the best new normal we can get to today? How can we grow and change through this challenge? I think the best way to cope as we go through this next journey, right, of vaccinations and watching what the virus does next, continue to do all those self-care things, which I hesitate to say because it's so much easier said than done. Exercise, sleep, gratitude, empathy, things like that. Really become aware of your thoughts and feelings, give them space, write them down, reach out to others. Tanya, this will be a funny one for you. Limit media is one of the biggest tips, which is hard for a lot of people. And then we just really encourage people in this. We're all going to be going through changes with the ups and downs. Reach out if you're concerned about someone. Make it okay to talk about these things.
Well, Laura Murray, thank you so much for joining us. We really appreciate your insight.
Thanks, Tanya.
If you or someone you know is struggling with suicidal thoughts, the National Suicide Prevention Lifeline is available 24 hours a day, 7 days a week. That number is 1-800-273-8255 or text TALK to the number 741-741.